Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Okay, for today's topic, we're going to talk about gastroenterology, and within that, we're going to talk specifically about heartburn, ulcers, endoscopic procedures, and all sort of issues that are relating to that domain. And for today's program, we have with us in our studios our expert, Dr. Adnan Qadir, who's a gastroenterologist from Hearts International, Rawalpindi. Thank you very much, Dr. Adnan, for joining us here today.
Thank you for the invitation.
Okay, so before we come back to our expert for questions and to discuss about this in detail, we're going to have a look at this report. Hope you found that informative, and now we're going to turn to our expert, Dr. Adnan. Now, we often hear people saying, if we take the Urdu terminology, pet mein jalan ho rahi hai, or you're getting heartburn. What exactly is it? What's happening?
Yes, absolutely. You are very right in saying this. Heartburn is very common problem, and according to a rough estimate, it is stated that 40% of our population at least suffer with these complaints of heartburning once or twice per month.
40%, that's a huge number.
So you can see that how much common it is. Actually, what happens is that the stomach acids and juices basically they flow back into the food pipe and then causes severe burning feeling which starts from upper abdomen and goes towards the chest, and sometimes also involve throat and neck and back also.
Back also?
Yeah. Basically, the normal mechanism is that when we swallow food, it goes to the food pipe, which is called esophagus, and it is 10-inch long and 1-inch wide muscular tube. It undergoes a series of contraction and relaxation, peristalsis to be exact. So the purpose of this peristalsis is to transmit the food from esophagus to the stomach, where the proper process of digestion takes place there.
Right.
So when food reaches the lower part of the esophagus, there is a muscular tube, circular muscular tube, which is called lower esophageal sphincter.
Okay.
And normally it remains in contracted form, it is closed.
Okay.
When food reaches near it, it relaxes and then allows the food to enter into the stomach for the process of digestion. But once the food reaches the stomach, it contracts and it becomes closed. And now whatever may occur, it does not allow any food or acidic juices to go back into the food pipe.
Right.
So in this reflux and GERD, the gastroesophageal reflux disease, what occurs is that this lower esophageal sphincter become incompetent.
Okay.
And as the stomach contracts and releases acid, then these acidic foods
starts flowing back.
Yes, and that's the lining of the esophagus is very delicate, and it's not made for this acid naturally.
Right.
So when the acid comes in contact with this lining, it causes severe damage, and if repeatedly, if it occurs for long term, it can cause many complications as well.
Okay. So can symptoms of heartburn be confused for having a cardiac issue?
Yes, you're very true. Sometimes the chest pain is so severe and it is not in burning. Burning, there is no, it does not mimic the burning. It's like a pain, just like that of ischemic heart disease patients.
Okay.
So the proper history and the risk factors and all these things, they had to be included in proper diagnosis. So you are very right that the heart disease can mimic this esophageal symptoms.
Okay,
Yeah.
right. So a person who's having these symptoms, as you explained, it's, you know, sort of a pain in the chest, doesn't have to be a sort of a burning feeling each time. What should they do? Who should they, of course they would see a gastroenterologist, but then how are they diagnosed that it is heartburn?
Usually the diagnosis of heartburn is straightforward. The patient has typical history, he is obese, sometimes smoker, and after taking a heavy meal, when they lie down they have these symptoms of burning, and this burning is sometimes associated with non-burning chest pain, and there are some associated symptoms also which can make the picture clear. For example, the patient may have feeling of lump in throat as well, and then at night time they may have choking sensation when the acid goes back into the throat and into the lung.
Right.
So, and the patient may have difficulty in swallowing, painful swallowing. So all these symptoms, when they are collected together in one picture, then we are very clear. But in few cases, when the diagnosis is not very clear, history is not very clear, and there are risk factors for ischemic heart disease, also like patient is diabetic, hypertensive, family history is there, then we have to investigate the patient. We may do endoscopy on him to see the status of the ileus sphincter and damage to the lower part of esophagus, where it usually occurs when the patient having long-term history of these reflux, and also to investigate, to do some ECG or ETT to rule out any cardiac issue as well, because they both mimic and they
the same symptoms.
yes, with same symptoms.
What about children, very young children, babies as well? You know, you hear a lot about when you're burping a baby or whatever, and they have lots of gastric issues as well. Can babies also be suffering from
Yes,
reflux?
babies can have this problem. It's very common in babies. Usually when the mother feed the babies, and after feeding they have to take the baby and then tap on the back so that the milk should go down into the stomach
the
properly.
baby.
And if it is within the esophagus and patient, the baby is made to lie down on the bed, he can have. So in the babies the lower esophageal sphincter is not as much functional as in adults, so they have, most of the time they have this burping and this GERD as well.
Okay, so if a baby has you know, a very young child, an infant, has this acid reflux problem, how are they treated?
Usually the mother are asked to give some time after feeding. The baby should be kept elevated so that the effect of gravity comes in and the food is gone down. And if in some babies, if they have increased episodes of these reflux, they may need some medicine as well, which are called prokinetic, which increases the motility of the stomach, and the distension of the stomach is decreased, and the food goes to the small intestine earlier, and the reflux symptoms they are decreased. Then there are few medications which decreases the production of acid as well, so they are also very effective. So first of all, lifestyle modification is important. If it does not control with this, then we have to give some medication as well.
Is it the same treatment for adults?
Yes, but the dose is different, as we know that.
Of course. Right. Okay. So what about lifestyle changing tips as well? I mean, what you mentioned that what a person who is suffering from the acid reflux and the heartburn, they'll be given the medicines as well, as you said. And what else will they be told to do to, you know, improve their health?
You know that lifestyle changes, they are very important. The lifestyle we are having, a majority of our population today, they are very prone to develop these reflux symptoms because they eat heavy diet, fatty foods, spicy foods, and lot of these cold beverages and tea, coffees, and then don't exercise at all.
Right.
So what will these things do? The lower esophageal sphincter relaxes with these foods, these coffee, chocolates and tea and spicy foods, and they remain in stomach for a longer time. So the stomach remains distended for a longer time, and it secretes much of acid, and then these acid increase acid quantity, and the lower esophageal sphincter is already relaxed, so the acid goes into the esophagus. So lifestyle modification is, it's very, very important. We have to lose weight, increase obesity, increase abdominal fat, as we know that the abdominal fat exerts a pressure on the stomach. Stomach is deep inside our belly, so abdominal fat compresses the stomach and the pressure inside the stomach is increased, and these patients are more prone to have reflux symptoms. Then most of our population, they usually take large meals at night, and then as they are exhausted due to the whole day activities, so they use these social media and TV programs, and then they go to bed. So most of these reflux symptoms, they are more at night. So if we can change the timing of our meal, we have small frequent meals and small frequent meals, so that at one time we should not pressurize the stomach.
And what time should we sort of take our last meal before going to bed?
At least 3 to 4 hours before.
3 to 4 hours before.
And then if we do sort of small exercise like a walk for 15 to 20 minutes, that is very good. Then smoking is very important. As the smokers, the saliva, they are produced in less quantity in them. The saliva, usually when the esophagus have this reflux acid, saliva clears this acid. So smokers have decreased this saliva, and their acid production is also increased, and again
that also is a high risk factor
so smokers,
for people who are smoking.
So we advise usually these patients to quit smoking and stop taking alcohol and these spicy foods, cold beverages, junk food, and to exercise.
Okay, so what do cold drinks do? Because it seems that everybody is sort of, it seems like they have an addiction to cold drinks. You know, where if you go to a dinner or somebody's over at your own place or you're eating out, it seems to be an essential part of the meal. So what is so bad about cold drinks? What are they doing actually?
It has become a part of our meals, and again the media has played a bigger role in this. We know in the ads that a person is drinking the cold drink and he can do any miracle. So the masses are feeling that if we can drink, then we also can do this thing. So the point is this, that cold drinks contains excessive calories and they are not being burned, so patient gets high BMI, and there is the pH is lower than the normal, so it can also produce more acid, and the acidity in the stomach increases as well. And a long time if we use it, as the BMI would increase, and patient is more prone to have reflux symptoms.
And then the high sugar content.
Yeah, high sugar content. These patients with high BMI, high body mass index, obesity, they are prone to develop many other complications as well, apart from these stomach issues, like cardiac issues, diabetes, hypertension, osteoarthritis. Many malignancies have this obesity as a risk factor, the smoking as a risk factor. So all these things combine together and make a problem for a person.
That is really important advice that Dr. Adnan is giving. Cold drinks, sometimes they seem to be harmless to us, but actually what you're doing is you're setting yourself up for a lot of problems down the road. And he's spoken about smoking as well, spices and oil. What about oil? Because we seem to have a lot of oil in our food as well.
Again, the principle is same. The fatty food, it takes the longest time to clear from the stomach.
Right.
And if the food remains in stomach for a longer time, stomach remain distended, and the pressure on the LES, the lower esophageal sphincter, is increased. And then when it remains for the longer time, it increases more acid as stomach get irritated. So the purpose behind the advice, which I have also mentioned before, that small frequent meals to decrease this distension and increase the mortality.
What does distension mean for people who are not familiar?
Like when we eat food, the stomach gets swollen up due to the food and gases they are secreted. So if the diameter of stomach increases more, the distension is more, then the pressure on the sphincter, the esophageal sphincter, that increases, and reflux symptoms increases. So if the fatty food is avoided or large meals are avoided, this distension can be lessened, and the stomach irritation and stomach acid production can be lessened, and as a result the symptoms of the reflux would decrease.
Right. Okay, another, this brings me to an interesting fact that we see many times happening is that when people eat too much or they feel that they're really full, they'll want to have a fizzy drink because they feel like, I've got eaten so much, there's indigestion, they've got a lot of gas or whatever, they're feeling sick. They'll turn to fizzy drinks. And is that a myth, or is that making the situation worse?
Yes, absolutely. It's making the situation very worse. The remedy and the solution is to this problem is not to overeat. We know.
Of course.
What our religion says that we should
keep one part
for the food, one part for the water, and one part for the air.
Yeah.
So meaning by the message is that do not overeat at one time, and eating should be small, healthy diet containing much of fruits and fresh vegetables, juices, fiber, and less of this meat and fatty food, spicy food, and then also to go for exercise to burn these calories.
Of course.
So if they are not burned, they would be deposited, and it will make the abdominal fat and make a person obese, and then the whole cycle starts. At the end, the patient may get diabetes, hypertension, these reflux symptoms. So that all these conditions, they are interrelated, and the lifestyle is the integral part in causing the problem and also in treating the problem.
Absolutely true. Okay, many people say we're so busy, we can't find the time to exercise. So what tips do you have for them? What can they do, at home or wherever in a specific, to take out time for yourself is really, really important.
Really important.
Everyone can do that if they manage it properly. What's the easy way to exercise?
The easy way is to inculcate this daily routine, this into our daily routine. Like if we go to office, we do a walk of 15 minutes before going to office.
Okay.
In office we have breaks, we can do a walk, go for a walk there. And at night after taking meal with family, we can do. So this has to be inculcated in our daily routine, and we have to enjoy this and not feel it like as a burden. We have to do it. No, with outing with family, outing with friends, and walking a lot. Not to use these automobiles and these vehicles. Just to walk. This is simplest exercise.
It's all about mindset as well, isn't it? To be mindful of a certain priority in life, and then automatically things will fall into place. For example, if we're going out shopping, park the car further away, where where you have to go to shop, and then you will be having that walk anyway. So it's exactly as you said, it's all about priorities. Okay, so now we can talk about stomach ulcers. Okay, you see many people, again, a problem in our society, in our culture, is not only self-medication, but also self-diagnosis. We seem to skip out a very
common in our
important
society.
Yes, exactly. Somebody will hear symptoms from someone and say, okay, is this what you have? Yes, I have this. Oh, I have the same things. Well, then you have a stomach ulcer. So now you need to take this. How do you go about addressing society and informing them through awareness campaigns, and as well get the public to understand what exactly is a stomach ulcer and what are the symptoms?
Basically, the peptic ulcer is the medical term used for this ulceration. Peptic means related to acid, and it involves the breach in the mucosa of the upper GI tract, which includes the esophagus, stomach, and the duodenum. But the most common ulcers, they are in the stomach and the duodenum, which are called gastric ulcers and duodenal ulcers. So the process starts from the gastritis or duodenitis, meaning
Tell us what gastritis is.
Gastritis is the inflammation of the lining of the stomach.
And what are the symptoms for that? And
the symptoms of the gastritis and the peptic ulcer, they are like a mixed one. One cannot be very sure that these are the symptoms of gastritis and these are the symptoms of the ulcer. But the ulcer tend to be, as we know that it is the last stage of the gastritis, so the patient may have more severe symptoms with the ulcer. Usually the symptoms are feeling of abdominal pain and more after eating, and then feeling of nausea, burping, bloating, and vomiting at times as well. The duodenal ulcers and the gastric ulcers, the symptoms usually overlap, but there are some basic differences as well.
Okay.
Duodenal ulcers, they the pain starts 4 to 5 hours after eating.
Because that's the longer it's taking to move to the duodenum?
And then these patients, they tend to wake up at night at 12 or 2 a.m. due to the pain. And the pain is like hunger pangs. And whenever the patient takes some food, it gets relieved.
Okay.
And the gastric ulcers tend to be, they aggravates, the pain aggravates when the patient takes food. So these patients, like they tend to avoid foods to lessen the pain. As a result, they may lose weight.
Lose weight.
Yeah. So these are some differences, but usually they overlap. And the duodenal ulcer is more common in our society. Gastric ulcer is little bit less common. But the important thing about the gastric ulcer is that, as we will discuss afterwards, that the gastric ulcer may have some part of malignancy in it as well. So if any patients have gastric ulcer, usually after 4 to 6 weeks, the medications are given for 4 to 6 weeks, and this time period is sufficient for ulcer to heal. So it is recommended that any patient with gastric ulcer should go for repeat endoscopy after 6 weeks to confirm that the ulcer has healed. If it has not healed, then the suspicion rises that may have some malignancy part into it. Then we take biopsies from the center and margins of the ulcer and send it laboratory for assessment and analysis to confirm that whether malignancy is there or not. So these are some smaller differences, but usually they present as same, their complications are same, and their treatment is usually same.
Right.
Yeah.
So who is who's more at risk for these ulcers? And having said that, what are the causes?
Yeah, it's a really very important question. There is a bacteria called Helicobacter pylori, and it is involved in the cause in more than 90% of duodenal ulcer, and more than 70% of gastric ulcers, they are caused by these H. pylori. It's a very resistant germ, and it is very interesting to know that more than 50% of whole population of world is infected with this bacteria, and usually it takes place in the younger age, in the childhood age. But most of them clear this infection, and in only 15 to 20% of these patients, they develop these symptoms of gastritis and ulcers. H. pylori is a gram-negative bacteria. It resides in stomach, and you know that the environment of the stomach is very acidic. So how it's possible for this bug to remain inside and cause problems? So very interestingly, it has an enzyme which is called urease, which produce urea, and this urea is alkaline. It neutralizes the acid.
I see.
So the area around this bug is neutralized by this urea, and acid can't do any harm to this. Then this bacteria releases certain enzymes and metabolites which will infect the gastric lining, and then together with this acid, it will cause ulceration in long term, and it can also cause some malignancy as well in the stomach. So
if it's left untreated.
Yeah. So it's a pre-malignant, nowadays it is called pre-malignant as well. So if any patient having symptoms and diagnosed as Helicobacter pylori, then we should treat them, and after treatment we should reconfirm, retest that whether this bacteria has been eradicated or not, because these are very resistant to antibiotics. Earlier we were using some brands of antibiotics, and it was 70% resistant to that antibiotic. Now there is a treatment which is called sequential antibiotics. 3 to 4 antibiotics, they are combined and given in a specific way to eradicate this bug, and that is effective. It eradicates more than 90% of. So the most common cause, coming back to your question, is bacteria. The second commonest cause is drugs. There are some drugs which are called NSAIDs, non-steroidal anti-inflammatory drugs, to make it simple, the painkillers and the blood thinners. As we know that people are self-medicating themselves, having headache or having any leg pain or anything else. Particularly the old age patients, they have arthritis, osteoarthritis like that. So they take medications and painkillers for a longer time. And there are cardiac patients, they take aspirin and blood thinners. What they do is that they inhibit enzyme in the stomach, COX-1 and COX-2. As a result, the prostaglandins, they are usually produced in stomach, and they control the blood flow to the stomach, and they secretes mucus and bicarbonate. What it actually does is that the mucus and the bicarbonate, it coats the lining of the stomach and prevents the stomach lining from the acid. Our creator has made such a beautiful mechanism that we all are secreting acid continuously, but that acid is not doing any damage to our stomach, because there is a delicate balance in our stomach. You know, there are some hostile factors, there are some preventive factors. The preventive factors include this mucus secretion, the bicarb secretion, and that is controlled by prostaglandin. Prostaglandin is an enzyme which increases whenever there is an insult in the stomach, then the protection factor increases by increasing the mucus secretion. So whoever is taking these medications chronically for a longer time, the prostaglandin secretion decreases. As a result, the protection factor goes, and the acid is free to then cause damage into the stomach
and to eat away into the lining.
Yeah. So very common population is that cardiac patients, and these patients who are taking painkiller, they come to us with severe pain, bloating, burping, and sometimes they land in hospital with bleeding, blood in vomiters or blood in stool. And although fortunately it is not a very common symptom of the ulcer, but when it comes, it may cost life of the patient. If patient does not land in the hospital in time and got late, then he can bleed to death as well. So usually if patient comes,
these are those warning signs that must be taken very seriously.
If patient come in time to the hospital, we usually resuscitate the patient, give some fluids, keep the BP above some certain level, some medications are given, then after stabilization the patient underwent the procedure of endoscopy, and we usually go in and we give some medication into the ulcer to stop bleeding. And you know, there is a vessel under the ulcer, and actually that vessel is bleeding. So what we do is that we apply a clip or endospray or coagulate that vessel, and this is the best treatment for the ulcer bleeding. So the endoscopic procedure is life-saving in this case.
So you go to the source, and that has to be done via the endoscopy. Okay, right. Okay, as you're talking, you know, about the ulcers, and we talked about the reasons why we have them. When we talk about dietary changes, is it the same as we were talking about the heartburn, or more specific dietary changes are needed for an ulcer?
Yeah, it's again very important question. There are some differences. Gastroesophageal reflux disease, it has direct relation with lifestyle and these spicy and fatty diets. But as we have discussed the causes of the ulcers, the main cause is H. pylori and drugs, and the smaller causes or less important causes are smoking, taking alcohol, and stress. And what diet does is that when the ulcer is present already, it stimulates further acid and irritates patient more. You know, it does not cause the ulcer, but if ulcer is there, it will aggravate the symptoms of the patient in ulcer. But in reflux disease, as we know that, as we have discussed, that it causes the relaxation of the sphincter, and acid production is more. So in reflux, it has direct relationship, but in ulcer, if the ulcer is present already, it will aggravate the symptoms of the patient. So in ulcer, the infection and drugs, they are more important to deal with.
Right. Okay. Can children get ulcers too?
Not very commonly. No, it's not very common.
What age can a person, you know, be susceptible? At what age can you start?
Above teenage, the patient may have, because the smoking is there, the dietary habits, the spicy foods are there, painkillers, and these infections. As we have already told that in childhood or in adulthood, early age, the patient usually gets this infection. So H. pylori comes into action after 5 to 10 years. So all these factors when get together, then the ulcer process starts. So from teenage onwards, and it can be, the patient can have, but the elderly, they are at more risk. Because the regeneration process is slow and they have many comorbids, the diabetes and the ischemic heart disease, hypertension, all these things are more common after 40s.
Right.
You know, so they are taking multiple medications, and root cause of these disease also common. So elderly, they may have more ulcers, and the complication rate is also more in the adults and elder patients.
Right. Okay. Is there any way to safeguard oneself from this bacteria?
Yes, if any patient having these symptoms for more than 1 month, he should consult a proper gastroenterologist, and he should evaluate the patient properly, taking history and examination. And if the patient having alarm signs, if the patient having age more than 50, or taking painkillers, or smoker, alcoholic, and he is losing weight, and appetite is lost, and he's anemic, his blood levels
Those
are down.
all indicators.
These are alarming signs, and the patient must go endoscopy, and endoscopy in time will do the diagnosis properly, and after doing the diagnosis, proper treatment can be given to the patient. So hence it would be very beneficial. So the message is that every patient with symptoms of burning and abdominal pain does not need endoscopy.
That is a very important point.
Yeah, does not need endoscopy.
Yeah, that is very, because it seems that, you know, many people find that it can be something that is overprescribed in certain situations. As you have put those markers ahead, you know, that these things need to be identified first, and then we go into this. Can a blood test tell you if you've got an ulcer?
No. Going back to the definition of ulcer, as we have talked, that the ulcer is the breach in the lining, the defect in the lining of the stomach or the duodenum. So that defect cannot be identified or determined in the blood test. So the diagnosis is by endoscopy. But again, as we know that H. pylori is the commonest cause of these ulcers, so the detection of H. pylori can be done with the stool test, urea blood test, and blood test, but that would not signify that the patient is also having the ulcer inside.
Right.
Yeah.
It could say, you know, that they don't have this bacteria, but not necessarily that they're not suffering from an ulcer.
As we have already said, that only 20% of these patients having H. pylori, they have symptoms and ulceration. 80% they usually clears the infection, but the antibodies remain there. So the more specific test is the stool test and the breath test. That actually can tell us that patient actually having the bug at this time. Then again, bug is there causing gastritis or duodenitis or ulceration or nothing. This can be done with the endoscopy in those set of patients whom they are having increased symptoms and these alarm signs.
Okay. One thing that is very common, maybe a myth, but then as you've just described, you know, it doesn't seem to be. Many people say, you know, don't worry so much, you're going to give yourself an ulcer. So the worrying, if you are a consistent worrier and you're putting yourself in stress, that can also contribute?
Yes, very important. There is association of depression and anxiety and type 1 personalities who are ambitious and anxious more of the time. The stomach in these patients tend to increase the acid production, and these are the patients, they if even don't have the ulcers, they have the GI symptoms more commonly, like burping, bloating, and epigastric pain, heartburning. They are having more these symptoms, and as a result, when the disease is severe in these patients, then endoscopy will tell that, yes. So again, coming to the question, yes, there is a relationship.
There is a relationship.
Yes.
Okay. So what, first of all, type 1 personalities, what is the definition of a type 1 personality?
Like any person who is ambitious, have high aims and strive for that, hard work for that, thinking for that aims all the time, completely indulge in that whole activity. These
obsessive?
Are, yeah. Not obsessive. Obsessive is too but they are ambitious and hard-working and intelligent patients, and
So they might
tend
be
to increase
setting too high
too high goals,
goal for
and
themselves that may
then
not
striving
be
for
achieved.
that. Yeah.
Of course, may
Yeah.
not be achieved. So then they will
Again,
constantly.
one interesting thing I would like to share, that these are the persons which, if in comparison to other persons who are not stressed, if they having the same intensity of the disease, the stressed person will feel more pain and more discomfort. Their threshold level is lower. So if the problem is same in the both persons, but the stressed one will have more complaints. It will causing more pain and discomfort in this patient, because he is sensitive, having stress. So this is also very important. Yeah.
Okay, so like we're saying, you know, stress is interlinked. Many things are interlinked with this issue as well. What advice do you give to people who are watching this program, who know that they're living a high stress lifestyle, and they know that, you know, some things you can't change, some things you can? What is your advice to them? How can they make their life easier and be sort of nicer to themselves?
So I would like to say that take things easy, and everybody is stressed. So we have to learn how to cope with the stress.
Absolutely.
You know, and we should avoid excessive stresses, and we should be rational, and we should not aim for the things which we cannot do, and we should accept the reality and try to cope our stresses and be relaxed, and to do exercise and drink lot of clear water, and these things will help a patient, and share your problems with others.
That's true. That's
Trust,
a very
trust anyone
important
at least.
part. to
Share your problem with
problems.
family.
Yeah.
Nowadays, due to the excessive use of this social media and everything, we are not even connected with our families.
That's very true.
The distance inside the house is increasing,
That's very
and
true.
we are not sharing our problems. Like, so by sharing and by sharing our problems, we can lessen the stress as well.
Okay, so we have some questions as well. So one of those questions is that, you know, probiotics and also food that is good for your intestines. What is a probiotic? What does it do, and how can it help?
Usually, our population is fond of self-diagnosing and self-medication. Whenever they have flu or any like viral infection, like in winters, usually everyone gets this flu and symptoms, upper respiratory tract infection. These are viral, and these infections, they have nothing to do with bacteria. But we are self-medication. We are doing self-medication to ourselves and getting antibiotics frequently. This causing two problems, big problems. One is that the bacteria become resistant to these antibiotics, and the second is that, as we know that we have a flora of useful bacteria in our guts that is in millions, and it does useful work for our body. It produces vitamin K, and it helps in absorption of many foods, and it's also fight back the harmful bacteria as well. So with excessive use of antibiotics, we are decreasing this useful bacteria population in our gut, and as a result, the person who is taking excessive antibiotics and other medications, they may have symptoms of bloating, gases, altered bowel habits, sometimes constipation, sometimes diarrhea, feeling of gases in abdomen. So in these set of patients, we usually give probiotics, and the purpose of this medication is to restore the useful bacteria levels in our gut. And it's very interesting to tell that yogurt is containing the useful these bacteria, and it's a natural, you say, probiotic. And apart from probiotic, it also contains many nutrients. So including this yogurt in our diet, and then fiber. Fiber is very important nowadays.
And fiber is found in
Espagol husk, and these fresh fruits and fresh vegetables. 30 gram of fiber is recommended for every person on daily basis. But these junk food, these burgers and pizzas like that, they have no fiber in them. So the patients, they usually come with gases and constipation, gassy abdomen. So we advise them to take yogurt and take these spagolahas and fresh fruits, fresh vegetables, they not only contain fiber, but they also contain many antioxidants, anti-cancers, so they are very beneficial. So the main message is that the balanced diet, everything should be included in our diet.
And that
we should not stress on one part, only on protein, only on carbohydrate. Everything is important, from fiber to carbohydrate to fats to protein to everything is very important. So our diet should be a balanced diet and with the daily exercise.
Right. Dr. Adnan, Qadir, thank you very much for joining us here today. Unfortunately, we're out of time, but everything we've talked about has, I'm sure, been very, very beneficial for our audience. Thank you
very much. My pleasure to be here. Thank
Likewise. You. Okay, so as Dr. Adnan said, you know, balanced diet, and not only just a balanced diet, a balanced outlook to life in general. If we're balanced in what we do, we will, I'm sure, be able to flourish and be able to take care of ourselves better than before. So until next week, stay happy, stay healthy. Bye-bye.